Hello and welcome to the Minds in the Frontline podcast. I'm Jeff Lassers, one of your hosts, and I'm a professional firefighter, paramedic, educator, and content creator. In this episode, we cover how first responder organizations in Michigan can start a peer support team and how the FST-5 program fits into that process. Most frontline agencies recognize the importance of peer support. What's less clear is how to build a team that people trust, use, and sustain over time. This episode is intended to provide a clear starting point. Joining me in the conversation are Mike Mattern and Mike Wierenga. Mike Mattern is a career firefighter paramedic with the City of Dearborn, a founding member of the Dearborn Firefighters Local 412 peer support and CISM team, and a peer support specialist with the Frontline Strong Together 5 program. His work focuses on supporting first responders through both critical incidents and day-to-day challenges. Mike Wierenga is a retired police officer from the Grand Rapids Police Department, a former firefighter, co-founder of To the Rescue, and a peer support specialist with the Frontline Strong Together 5 program. He delivers peer support, CISM, and first responder wellness training grounded in real-world operational experience. Individually, both have built and led peer support programs and responded to critical incidents. Through their work with the Frontline Strong Together 5 program, they now help first responder agencies across Michigan develop and implement peer support teams through structured training and ongoing support. During this episode, we define what a peer support team is and how it fits into the day-to-day reality of the job. We break down how it differs from critical incident stress management and how the two systems complement each other. We also cover the training, structure, personnel, and clinicians needed to build a team, along with the importance of confidentiality, legal protections, and peer supporter self-care. This conversation is intended to provide a clear starting point for launching a peer support team. If your organization is looking to start a new team, strengthen an existing one, or expand your capabilities, the next step is to reach out. Through the FST-5 program, agencies can access training, development, and ongoing support at no cost to the organization or its personnel. You can contact us directly at info@fst5.org for more information. Minds on the Frontline is presented by the Frontline Strong Together 5 program. FST-5 offers 24/7 mental health and crisis support for Michigan's first responders and their families. If you or someone else you know needs help, call 1-833-34-STRONG or visit fst5.org to learn more and explore our free training options for Michigan's frontline agencies. Wayne State University administers FST-5 with grant funding from the Michigan Department of Health and Human Services. Together, we're dedicated to strengthening the health, resilience, and well-being of Michigan's frontline community. Please follow us on social media and enjoy the show. Good morning, gentlemen. How are we?
Good. How are you, Mike? How are you doing?
Good. Good morning, guys.
Glad to have you on here today. Thanks for coming.
Thanks for the opportunity and the invite. Appreciate it.
Hey, you're welcome. Now, Mike Wierenga, you're used to being a guest here. Mike Mattern, you're not really a co-host today because you're going to be answering a lot of questions.
Sure.
So, although we give your background in the introduction to this, give a little bit more detail into your background, of who you are, and your role as a peer support team member outside of FST-5 and what that actually looks like at your agency.
So I've been doing peer support since 2017. We started a team at my department. Back in 2017, it was fairly new, so we kind of learned as we went. There wasn't a lot of, guidance on how to start a team. Our team's been running. We get somewhere around 300 to 500 contacts a year.
What does that mean, contacts?
Anytime we have a contact with a peer.
So somebody reaches out to you or you reach out to them for
either
any
or.
reason?
Okay. If we make contact with someone about peer support or anything like that, it's considered a contact. So
okay.
From there, I started, got my CISM training. I got my IFF peer support training, suicide prevention intervention trainings, went on, started working with MCRA, the Michigan Crisis Response Association. I'm one of their board members, former chairperson of the Michigan Professional Firefighters Union Behavioral Health Committee. I work here at Frontline Strong as a peer support specialist. Also go out and teach how to start a peer team, peer support training, going to be an instructor for the CISM here soon. and then also suicide prevention intervention training. So on top of doing some peer support and stuff like that. So.
And on top of being a professional firefighter, paramedic, an officer at your agency, and a dad.
And a dad. Yep. All those things all in once.
And he's smiling today. That must mean he got sleep last night. Well, that means you're going to be quite an expert to tap into for this topic today, where I hope I can guide us through the conversation and pull from you guys' brains and experiences. Mike Wierenga, same question. Give us a little bit more background on yourself as a peer support team member, as well as what led you to that role.
Well, it's kind of unique for me. I was involved in a couple events very early in my career as a police officer and a firefighter, medical first responder. And it just kind of opened my eyes on, man, we're good people doing amazing things and helping people all the time. But where does it fall into this category of helping each other? Because every once in a while we'll run one of those calls where it's like, man, that was a rough run. And so I was very fortunate. We started our peer support team in the city of Grand Rapids in 1999. And I got involved in that shortly after that team started. Was very, very active with our peer support team, both with the police and fire side. We have very separate teams, but we did a lot of work together. We trained together. Sometimes our debriefings and our critical incident stress debriefings were affiliated sometimes with that communication. But what really got me going is just the interest of understanding that, taking care of each other is a big part of this game, and started getting involved in the ICISF classes, getting involved in the group, the advanced group, individual. We started our team at the time. It was called the Cop to Cop team for our police side of things. And that was established around the critical incident stress management training, and then doing more internal trainings and just kind of being available for those debriefings, diffusions, one-on-ones within our organization. Also kind of led me to do a little bit more work outside of the organization. We went to my fire department and did some training and started realizing that there's a need. There was a need for this. And so I'm starting my 20th year of traveling around the state, doing some training with To the Rescue, teaching different programs. Again, kind of like Mike said, how do we develop a peer support team? What does it look like? What does it sound like? Policy, procedures, what works for one organization does not work for the other. There's a lot of moving parts with that, and just glad to be a part of this through the work that we've done around the state with To the Rescue, and now being a part of the Frontline Strong group, and just being an advocate for this whole topic as a whole.
Awesome. Well, while I got you there, Mike Wierenga, give me your 30,000-foot definition of what a peer support team is and the value they bring to first responder agencies.
I've had a lot of conversations with people over the years that, you can be better employees, you can be better peers, but are we getting any additional training in that area that if we're going to actually reach out to somebody or have somebody reach out to us, what does that look like? And, your peer work, I truly believe, is really part of your day-to-day operations. It's your day-to-day interaction with your brother and sister responders, but also the importance of that is having them trained in that critical incident stress management and having the CISM background in that, and really having the ability, okay, now are we doing debriefings, diffusions? And if we are, making sure the team's prepared and trained the right way for that. So there's a couple of moving parts with that. And Mike and I have talked about that before too. And how does that look, to have a peer support team and have them trained in the right techniques to be able to do the work that they're doing? We can all be better employees. We can all be better peers. But how do we do it in a formulated format that really looks like, how are we handling this with the critical incident stresses, personal life events, call-related events, some protection, some confidentiality, some state law coverage? There's things in there that will help us with that.
So would it be a good loose definition from what I'm hearing and making sure that I track is that a peer support team is a trained group of individuals to make sure that we cast a net that filters through and identifies people that may be going through something that they need help with?
Yeah,
Very loose definition.
Very loose definition. Yeah, I think you're good there.
And now, Mike, that loose definition lends itself to a spectrum of different things that a peer support team can help with. Give me an idea from the spectrum of a 1 out of 10 problem to a 100 out of 10 problem.
That's where peer support comes in heavy. How you do peer support is it's for everything that's a chronic or a life event, right? Mm-hmm. So we've had peer support where it goes from, hey, I think I got stress and anxiety. Do you got, what do we do for that? Or, I'm not sleeping well at home, to, substance use problems. Hey, I've noticed I'm drinking a lot. I need, is there somebody I can go talk to? Sick parents, they're a caregiver for a sick parent. We've had it where, sick kids are in the NICU. I mean, you name it, you're doing exactly what you're talking about. As a peer, you're supporting them. We all kind of sit around and talk about the things that go on in our lives as it is. And anybody can really do it, right? You do need the training to know how to talk to people and things like that. But for instance, having somebody like a kid in the NICU, my son spent 2 separate stints in the NICU as a baby. I can go talk to that person and I'll tell him like, hey, listen, I don't know your exact situation, but I do remember he's hooked up to all the machines in the NICU. You're up there. You have to leave him at night and come back tomorrow. It's really just being that peer, and it's really just being that human being, really, to say, hey, listen, I made it through this. This is how I made it through this. You haven't walked this path yet, but I've walked it. So let me tell you how my path looked like. Maybe yours is similar, but this is how I made it to the other side of it. And that's really kind of the peer support stuff. But it's a myriad of issues.
Would it be safe to say that we're all peers?
Yes.
And a peer support team member can have a little bit more acuity as to understanding if something's really going on as a problem, and really where to direct this person beyond.
Yeah, the training also helps you kind of assess where they're at.
Okay.
You know what I mean? Like,
so it gives you a more human depth of, like, what am I actually looking for rather than a spidey sense.
Yes, exactly.
Because spidey sense is huge for people that we know, right? Mike Wierenga, if we're seeing people out there that are having issues, that's one thing. But then, like, I've been in the situation, and I'm not trained, everybody knows that who's listening to this show, is that I might sense that Billy's having a hard time. Mm-hmm. I'm not always comfortable asking Billy. I'm always calling a peer guy or somebody that person's tight with that has a really good connection with to check in with them.
Yeah, because, I mean, a lot of the training, what it teaches you is the active listening, right? We're not necessarily listening to respond. We're listening to understand. And that really helps. There's different techniques that you learn in the peer support classes, but a lot of it's not always for that person. It could be for their family, too. Hey, my kid is having this issue. Mm-hmm. What do you guys think I should do? Or, do you have a resource for my child or my spouse? You're really the caretaker of your peers and all of their stuff that's going on when they trust you enough to come talk to you about it.
Okay. Now, Mike Wierenga, help me out here. You've been doing this a long time. When I started in the business in the early 2000s, we always heard of the CISM teams, the debriefings. Those things aren't really new. Can you help us understand what a CISM team is and what they do and how that differs from a peer support team and what they do?
That critical incident stress management, that debriefing or the diffusion concept, these are with trained personnel. And most people will go through the ICISF, that International Critical Incident Stress Foundation training. That's more of design for, all right, we're going to go in and we're going to have a debrief and diffusion on a critical incident that maybe first responders were involved with. And a lot of the message and a lot of the training over the years, even when the CISM teams were very early on, it was peer driven. Even the creators of those organizations were a first responder background that said, how do we do a better job of having peers do a critical incident stress debriefing? That is the core, the base of this, if you will. But now having additional programs that talk about now the peer element, it really goes back to finding that trusted brother or sister within your organization or within the field that may have a little additional training. And that's one of the things that looks at is now when they have that training, knowing what to do with it. Now, you and I could sit down as two peers. We can sit on the tailboard of the rig. We can work that correction shift and maybe talk in the parking lot before we go home. I think a lot about our dispatchers and the lack of downtime they have between calls, whereas peers, they might be able to look at you and say, holy crap, that was a heck of a call. And they have that communication versus it's not a formulated debriefing or diffusion at the end of the shift. So sometimes the peer component can be more of your day-to-day activities. And I don't always want to say large-scale events because I don't always think that's the right way to look at that, but maybe having a call for service by a peer-driven team that can do a critical incident stress debriefing versus it's not a formulated debriefing or diffusion at the end of the shift. So sometimes the peer component can be more of your day-to-day activities. And I don't always want to say large-scale events because I don't always think that's the right way to look at that, but maybe having a call for service by a peer-driven team that can do a critical incident stress debriefing.
Yeah, and Mike, is that when you say critical, it's critical to the nature of whatever's going on and based on the circumstances of that agency. What's critical to a dispatcher is going to be different than a corrections officer because our environments are different. So it's critical to the nature of what you're doing.
It's in relation to what is critical to the people who are responding. And within CISM, we have two groups. We have, automatic call-outs and we have optional call-outs. So anything that we know is a critical event, something that involves a child, something that involves another first responder or somebody that all of these, we know that they are going to elicit that stress reaction, that trauma reaction. We're going to come out and talk to you. Those are our hey, listen, no matter what, if you have a kid run, we're at least going to come out and talk to you. Then you have your, what they call kind of optional, where it may not necessarily for you be something traumatic, but say it's a car accident, your friend in high school was killed in a car accident, right? That automatically puts you in that headspace. So it's traumatic to you. Let's come out and have the conversation. You can never judge on what is a traumatic event or not a traumatic event based on what you believe, right? We've got the automatics and stuff like that, but it's under those optional ones that it's traumatic to the responder. And you never know their background, which made it traumatic. Whereas a call may not bother you, but it for sure bothers me. What we do with the automatic call outs is for many years, we would call and go, hey, how's that crew doing after that run? And everybody's, oh, I'm fine. The officer, would answer the phone, hey, how's your crew going? Hey, you guys good? Yeah, they said they're all good. And then that was it, right? So with having those automatic call-outs, what that does is it takes away that whole worrisome, I don't want to be the one guy who raises my hand and says, hey, this call bothered me. If we come out, we're talking to everybody. Nobody has to take that hit of, well, I'm the only one that this bothered. No, we're all coming out. We're going to talk to everybody. It's all spread out. So it's one of those things where the automatic call-outs are nice because it takes that whole worrisome, like, am I the only one it bothered?
Right. You're automatically making it available.
Yeah.
So it sounds like a CISM team is that automatic situation where it triggers an event or a situation that allows this team to congregate and make things available in a debriefing or whatever needs to happen based on that situation, whereas peer support is an ongoing thing that never really ends. Sometimes the same people do CISM that they do peer support, but they are different things in their own way. But there is overlap and synergy. Talk about how the two complement each other.
Well, each of them have a separate set of skills that are specific to that, peer support or CISM. So if I only have CISM, then I'm only really focusing on those acute traumatic runs or situations.
Are there people that just do CISM?
Yes, absolutely.
Cool.
There's places that just do CISM. There's places that just do peer support.
Right.
If I'm only doing peer support, then when those acute situations happen, I don't have the training. I'm not equipped. But when you have both of those, that's when you really hit the wheelhouse of what you can do as a CISM or a peer team, because you're covering now the acute, the chronic, and everything in between that you can respond with.
You just have a more well-rounded group of people at your agency.
Yes, but it's
kind of being fire and a medic.
How I talk to you about necessarily a life event that's going on is not how I'm going to talk to you with an acute trauma.
They're different circumstances.
They
require a different pair of gloves.
Yes, in the CISM portion, I'm helping you try to process what you just dealt with, so there isn't a problem down the road, or you try to lessen if there's going to be an issue down the road. That's my goal with CISM, right? But if I'm talking to you about a chronic life event, I'm not necessarily talking to you about the thing that started the life event. I'm trying to help you now after this has caused an issue.
Right.
There's two different kind of ways you're talking to them and two different ways you're helping them process and work through these things. If you're only doing one or the other, at least in my opinion, Mike, I'm going to kick it over to you too, you're missing half of what you could be doing.
Yeah, Mike, tap in here.
Each team, you got to figure out what works well for your team, what works well for your community. Our peer support team members absolutely had to be CISM trained. We had to have them trained in either the individual or group. Obviously, at one point, that was the minimum requirement. But then as they were maybe senior members, they would get more into advanced training. And that was a requirement. And because what we wanted to do is we can do the peer-to-peer conversations, but we also have to realize at what point maybe is that next level of care needed. And if it's something that we can reach out and start out as a peer contact, does it turn into, hey, do we need to do a critical incident stress debriefing on this event? Or is it just, hey, this person's struggling because of a father at home who's dying of cancer? It has nothing to do with work, has nothing to do with per se a call for service or a group of responders involved in that event. So we kind of trained that way because it was important for us to say, okay, we can have a peer go train and get some additional training on suicide awareness in our culture, or burnout or PTSD. And so the one-on-one communication, they had a little bit extra knowledge in that area, if you will. But if we were doing a critical incident stress debriefing, they had to be trained in that concept. And so we just trained everybody in both. And that's just kind of how our organization did that. There's different thoughts. Different organizations have different needs. You might have one that says, hey, I'm going to get some additional training on the day-to-day stuff. And you might have one that says, I'm going to a grin training where they're going to go through the individual or the advanced individual or the group and have the ability now with the background certification to do the debriefing diffusion work. So you can have both of those within the same team, but it's important to understand what each role is within the team.
At the bare minimum, to be a well-rounded peer support team, you need the peer support training, the CISM training, the GRIN training, and suicide prevention intervention training. That covers 99% of what you're going to encounter as a peer team. In my opinion, those are the bare minimum that you should have if you're being a peer support team. What are your thoughts on that?
Yeah, I agree with that, because what happens a lot of times is we will reach out and find, okay, we want to do something. We want to get trained in something with this topic or around this area. And a lot of times, unfortunately, we do this one and done training where it's like, okay, yep, they're trained. Now we're done. It can't be a one and done training. We have to have the basics there. Any additional training you can get that is specific to suicide or PTSD, that's additional training, but where does it fall into making sure, again, I refer back to a lot of times to the ICISF classes, get the training to be a CISM team member so we can handle both. And I think that's important that that a lot of teams really look at that, because you can have both, but you're really to be, I guess, maybe the best well-rounded is having both options within that team.
Yes, and the big thing, the big change right now that I would say is when you and I were starting teams, we had to pay for them out of our own pockets. Our departments had to spend a decent amount of money. For everybody listening right now, everybody watching, all the trainings that we just talked about are completely free to your department through Frontline Strong. If you're wondering, or if you're an administrator sitting here and we're talking about, hey, you need these 3 trainings, it literally is $0 out of your budget. We offer all of these moving forward. So just keep that in mind. I just wanted to slip that in there while we were talking about it. But
no, absolutely. And you bring up a really good point. And those 3 trainings that you just said there are offered directly through. Let's go over them again.
Yeah. So we've got how to start a peer support team. So if you're starting out, you have no idea how to even get this thing going. We have a manual. We have SOPs that we can send out that are for all the disciplines. And actually, one of us comes out, teaches the class, and actually walks you through how to start your team. And actually, we stay with your team throughout the whole process. It's not like we come out for one class and then, we do the thing and it's all done. So we get you started on your peer support. So that's number one. That's the first class that we offer to you. Then every month, Frontline Strong offers CISM training through ICISF free, so you can sign up for that.
And that's also the GRIN training.
That's the GRIN training, which is groups and individuals in crisis through ICISF.
And so it's step 2 of the process.
Yep. And then also we offer suicide prevention intervention training. We literally help you start your team and get you trained to where you're ready to roll, even with SOPs throughout our program, and it costs you literally nothing.
Okay. Well, Mike Wierenga, as those teams get developed and they have all of those and they put them out into play, I got to imagine there's a number of laws that govern peer support programs, they govern CISM, and it also probably touches on confidentiality. Can you kind of give us an overview of how these laws protect the peer support teams as well as the people that need that support?
That's one of the things on why the two need to work together and why we need to train together and be certified in these concepts, because we have a law in Michigan that will protect us, a confidentiality law, and the confidentiality is a must. It is so important. I remember very early on getting involved in this concept where there wasn't a lot of CISM teams that were specific to first responder organizations many years ago. It could make or break a team very quickly if confidentiality became a problem. If we sat down and had a conversation, and all of a sudden at the end of that shift, at the end of that day, I'm in the locker room, I'm in the parking lot, I'm at the local tavern, and I'm talking about what we just discussed, it can make or break this organization's peer team or CISM team immediately and very quickly. And that's been a consistent theme. It's taught that way. It's educated that way. The format, the critical incident, stress debriefings, diffusions, peer support, anything to do with that, there's that constant element of how important that confidentiality is. And it needs to be reiterated over and over again, whether it's trainings, every training program that you have, or it's something that you build within the culture of those organizations and your teams. It's a huge, huge part of that.
Yeah, I mean, just to echo what Mike said, I mean, it is the number one priority of your peer team is the confidentiality. You lose that confidentiality, you might as well fold your team up and go home. And it only takes one time. It takes a lot of time to build that trust within that peer support system, but it takes one time for you to leak something and nobody's ever going to use your services again. Mm-hmm. And when you think back on how many contacts you have a year, If I get 300 contacts a year, think about those people who are now not going to use me. That's 300 people who may not go but to talk to somebody because one person leaked something one time.
Right, and now other people who might need help have one less place to go.
Yes, and one of the things that we have here in the state is what's called Michigan House Bill 444, which is actually state law that protects our confidentiality when someone talks to us. So basically what the law states is anything that's said to us, whether it's verbal, written, electronic, you name it, if it's something like a mental health crisis or anything like that, we cannot be ordered. We can't even be subpoenaed to talk about what we talk to.
Now, you're not a professional therapist in that situation, but you are afforded those rights as somebody who can be that person to accept that energy from those people they need to maybe discharge or at least help with, and they go from there, so you're protected that way. And I think that's great because it doesn't force the person to want to bottle up.
Yes.
If I know I'm protected, which means that you're liable for everything that you do in this situation, I feel a lot better just diarrhea of the mouth to get my feelings out for the millions of different things that we could use this for.
And it's been tested multiple times in court, and it's held up. The requirement, though, to be underneath that umbrella of that Michigan House Bill 444, you have to obviously have the CISM training, but also you have to be a registered team within the state through Michigan Crisis Response Association.
Okay, so you can't just be a person who went through the training or even just says they're on a peer support team and then be afforded this.
Yes.
You have to be an official.
Follow up real quickly on what Mike said too on the law, because it's important that we understand where that's at. And if you get on Michigan Crisis Response Association's website, the very first page, it will tell you the law. It's under Public Act Code 368 of 1978. And then the definitions, the confidentiality of communication, and then liability is broken down. And it's important to know where that's at, because a lot of times there's that confusion with who's involved in these conversations and where does that confidentiality fall. As you develop teams, we need to know where that law is at. And that's where that critical incident stress management training has to come in play. And it has to be under that Michigan Crisis Response Association board, understanding where that's at. They're very active in that law. So I just want to make sure that we covered that.
So Mike Wierenga, we've touched on the type of training that's needed, the details that go into that, operationally kind of what that looks like from a high level. But it takes a certain type of person to be a peer support team member, as well as a certain type of clinician to help those teams out. So give me an idea of the characteristics of the type of humans that occupy these roles.
The whole concept in the background is a peer driven. So one of the things that we have found out historically over teams that are established for a while is you try to get peers at the peer level. So you're trying to get firefighters, police officers, frontline medics, dispatchers, corrections officers. But then what happens oftentimes is as they go through their career, they get promoted. So, as you have now promotions of peer members. So what you're looking for is somebody that's well-known, maybe well-respected within the organization, trying to keep it at a peer level, because the team will naturally develop peers at different levels of command structure. Because a lot of times we'll forget, hey, the fire chief had a bad run too. So where are we at with peer support on that? And when you go through and look at your critical and stress management, a lot of that training and education, and a lot of the debriefings and diffusions will tell you rank doesn't matter there. But when you're developing a peer support team, if the chief walks into an organization and tries to have conversation there, where does that fall into place regarding maybe a well-respected peer standing up in a lineup after a call for service, reaching out to each other after a tough run? So finding those people are important, the people that are known, that are trusted. Don't find somebody in the department that does a lot of this, because people aren't going to be able to say, okay, that's somebody I'm going to go to, or that's somebody I trust. It's important to kind of look around and see who would fit well, who's passionate, who believes in it, who's able to help do what is done, and who's willing to get some additional training. Every once in a while, we'll run into a peer member and say, hey, I want to get trained on the peer team. Okay, what am I going to do? Okay, I'm going to CISM. Okay, I'm not doing anything else. And so it's a constantly revolving door with training, education, what's working, what's best practices, what we can do to keep this concept and this mindset going. Once in a blue moon, we've had a person that wanted to be on a team that went through a horrific event and wanted to use those experiences when they were ready, whether it was personal life, whether it was career involved, whether it was call for service. So that's a little idea and kind of some of the stuff we've looked at over the years.
Mike, tap into that. People tend to jump on peer support immediately after a big life event. Is that always best for them and the team?
No. It's good for the team that they're interested in doing it. I think each of us bring our own backgrounds, our own life events, our own traumatic events that we've dealt with within our career. But a lot of times after somebody goes through one of these things and maybe they went to go talk to a clinician or whatever, they really want to jump in because by nature, what do we do as first responders?
We want to act on our feelings.
Well, that, and we want to help.
So that's what I'm saying.
Right?
We want to act on it and be like, I don't feel good. I'm going to feel better helping.
Yes, we tend to help people. Even though we're struggling, we feel better about ourselves if we help somebody else rather than take care of our problems.
Which taps into the original discussion before
Exactly.
about why people become first responders in the first place.
Yes. So a lot of times when we have somebody or other, we talk to other teams that, I really want to go do peer support. I went through this. And a lot of times what we'll tell them is, okay, we'll take you, but let's get you through what you're going through first. Let's get you through that, whatever traumatic event, life event, whatever it might be. Because if you still got that hanging over your head, you take on a lot of stuff as a peer supporter that now is just adding on top of things.
So is it safe to say that a peer support team can acknowledge the significant impact somebody's gone through, but also should have the awareness of, are they ready for this yet?
Yes.
And is it a fleeting thought?
Yes, exactly.
This week it might be the flavor of the week, like it's really good, and then it settles down. You're like, maybe I don't have time for this.
Yes. I think some of the greatest peer supporters out there, and I'm not saying this is a blanket statement, right? But some of the really good peer supporters out there were the ones who went through some shit, right?
That's the other side, right?
Which is the other side of it, is because I'm not saying people who haven't gone through stuff won't make great peer supporters. That's not what I'm saying. What I'm saying is when you can sit down and have those conversations with people, you can speak from a firsthand experience where you've been where they've been.
Like an alcoholic leans on another alcoholic as a sponsor in a way.
Absolutely, 100%. So
it's not a prerequisite, but it can lend experiences to help that person further.
Yes. And a lot of times when you start talking to these, these people who are coming to talk to you and you tell them a little bit about your background, it opens them up to say, okay, well, this person's been through this before. I can, it takes away that kind of scariness of them admitting that something's going on or something bothered them, because you've made it okay when you go, hey, listen, back in 2015, I had a little kid drown in a swimming pool. I had real bad PTSD. I had to go through a whole bunch of therapy. And they're like, oh, really? And then you almost see them open up like, okay, so you're not going to make me feel bad for
because you offer that hope through saying
exactly.
So it's not as bad at the end.
But they also know that you're not going to judge them, right? Because that's a big thing where you're like, oh wow, you went through this too, and then they tend to talk a lot more once they realize, like, okay, this person's been in that same hole that I'm in. They found their way out.
So it's just another mechanism to get them to open up about what's going on with them, to allow them to maybe talk through it, to figure out what is the next step to fix it or address whatever the millions of things
it might be. But you definitely have to have your stuff together before you start doing the peer support stuff. I love when people want to give back. I mean, that's really how I started getting into peer support was I had a whole bunch of stuff go on. I had PTSD. I went to go see therapists. And afterwards, it was like, there's got to be a better way. I don't want somebody to go through what I just went through, right?
So it can be a strength as long as it's the right time and the right thing for that person, and the team has to be responsible from kind of understanding, is this person ready for this right now on their behalf?
Yes.
Okay. Now, guys, one of the thing I've noticed is that having a really good clinician on staff helps, because there's only so much you can do. You're probably you two are probably the most detailed peer support guys in the whole state. People guys call you guys for information. You guys do how to start a peer support team. That's why we're having this discussion today. But your professional abilities only go so far.
Yeah, absolutely.
So let's talk about the role of the clinician and picking that clinician out. Mike Wierenga, you want to start?
Yeah, one of the biggest things that I'm a huge believer in with this whole concept is resources. We have to have the resources. We can only do so much with training and teaching and education, but when to know where we fall, what's the next level of care, what's the next step, who is it that we know, who's vetted, who do we trust, do we have a clinician that works just with corrections officers and their background will allow that? Let's find that person and send them as a resource. Do we have somebody that works just with our dispatchers? Do we have somebody that is maybe a medic or a child of a medic or retiree that now works just with that group, police, fire? Who are they and what's their background? And we've come a long way in this. And one of the things I think historically, we're like, well, they don't understand who I am. They don't understand my job. They don't understand my culture. There's some truth to that, but there's some amazing people out there that can help us as first responders. They're good at what they do. They have a background that can help guide us or facilitate us, and finding those folks are important to have as a part of your peer team. And whether it's a county resource or a mutual aid of a neighboring agency, or I'm in Grand Rapids or Kalamazoo area and I call Mike over in Detroit and say I need some help, or I call Susan or Christy in the UP and say, hey, I need somebody over in St. Ignace, or I get a hold of Colby up in Traverse City, Cadillac, or I call whoever it is I need to call around the state. Those resources are there, and it's huge. It's a huge part of this, Jeff, is understanding where are those next level of professionals. We can only do so much as a peer. We can only do so much during a debriefing diffusion. Where does the follow-up come, and who's involved in that?
So that's a good overview of, the type of resource that we need. What are the rules on a peer support team and even having a clinician, and how do you pick them?
To be an accredited team, you have to have a clinical coordinator, somebody who has clinical kind of oversight of your team. So it's that resource of, hey, I'm not sure what to do. Clinically, what's the right thing to do here? Or if you're way over your head, that's your phone call to, hey, I need to kick this up to the next level. So that's kind of, they are required for your team. You should have a clinical coordinator. And to be accredited and get that protection we talked about earlier, you got to have a clinical coordinator. That's
so it's all part of the requirements you'd be doing in the how to start a peer
Yes.
support team. It's probably one of the chapters, selecting and using.
Absolutely.
Wonderful.
Yes. Now, things that we're looking for and how you find your clinician. In our department, I knew the clinician. Other people knew the clinician. Very highly recommended. And it's word of mouth, right?
So you guys kind of fell into finding the right one.
Yes, but there's things that you can look for. The biggest thing that I tell people to look for is the personality. It's not necessarily the person with 17 degrees who's the best to work with us. There's plenty of people who have 17 degrees and they're phenomenal.
Sure, but it doesn't automatically make you culturally competent.
No. The best way that we found to really figure out if they're a good clinician or not, bring them in and do some third rides. Let them come into the firehouse. Let them come into the police station, corrections, dispatch center.
And this doesn't have to be a new person. This could be somebody who's a culturally competent clinician for years, and
Yes.
you just want to make sure they're right for your agency.
You're interviewing them.
Okay,
Yes.
because they could be culturally competent.
100%.
But what works for Dearborn might not work for WB,
Yes.
which might not work for Warren PD.
Exactly.
Right?
Bring them in because each of our places have different cultures, right? And it's vastly different no matter where you go. And you want to get the fit for who will be using this, right? If a lot of your people from your department are going to be using it, why not bring the clinician in? I remember having clinicians come to the firehouse and just watching them see how they interact at the kitchen table with everybody. We've had some that were phenomenal. Like they were ripping jokes like everybody else. And we had others who just sat there and we would ask questions and they were so clinical that they took 2 or 3 minutes to answer the question.
They're almost trying to be too professional.
Exactly.
Well, the professionalism is,
Exactly.
can you drink a cup of coffee and relax?
Can you sit here and shoot the shit with us?
Right. Are you a human?
Because in all actuality, when you go to therapy, what are you doing? You're sitting
having a
there
conversation.
shooting the shit with someone.
Right.
And it's the clinicians that have the personality of, it doesn't feel like you're going to see a clinician. You're going to go.
You're not going for a physical.
Exactly. You're going there to sit, like we're talking now, is how therapy feels with the right person.
Agreed.
So,
and sometimes, and like anything else, this conversation can't happen if we don't have the right vibe.
Exactly.
Even if we have the same goal in mind.
Exactly.
So it doesn't make them a bad. It's just not the right fit.
It doesn't make them a bad clinician.
Sure.
It's just find the fit that works with your department.
Yeah.
And it doesn't matter if that person's just got a master's degree. Doesn't have to be a doc. The bare minimum is a master's. That's the bare minimum you have to be a clinician, right?
Yeah.
And it doesn't matter if that person's just got a master's degree. Doesn't have to be a doc, right? They have to, the bare minimum is a master's. That's the bare minimum you have to be a clinician.
And probably preferably you want somebody who has at least, maybe not experience on a peer support team, and Mike Wierenga, maybe you could tap in. Maybe somebody who's at least had a lot of patients who are first responders, or at least a significant number. Their first patient as a first responder shouldn't be as a peer support clinical coordinator. Would you agree?
Well, sometimes you've got to look at what is their background, who are they and have they done work in this? One of the biggest questions you'll have, and oftentimes peer support teams and CISM teams that are first responder oriented will say, how do we know to find that right clinician? How do we find that right mental health professional? And you can call them up and say, hey, do you work with people that deal with trauma? Are you trauma-informed care? And they can say, yeah, I do all that. But then the next question is, have you worked with first responders? And of course, you're going to have some people that never have, but they have the right passion, the right background, the right ability, and they want to. So let's get them in, have them do those ride-alongs, have them do some walk-arounds, have them plug into that dispatch center and watch and see what's happening around them. And now we can get them involved in the team. And the other thing that's really important in this area is if they're involved with your peer team and they're doing any critical incident stress debriefing, they absolutely have to be trained in the CISM model. So we've got to get them also trained in assisting individual crisis or group or advanced or grim, because now if they're going to be a part of this as that mental health provider, we got to make sure they're trained in that area. And there's internally for reasons, state law reasons, there's other things that we got to make sure that they are kind of a part of that team as well.
And just quick piggyback on what you're talking about, when we started our team, we actually had our clinicians go through all the trainings with us. So she went through peer support training with us. She went through the suicide prevention intervention training. She went through the GRIN training with us. If she was working with our team, she went through the training with us.
So is it safe to say that person probably didn't learn a lot of the psychology of the situation, but more of understanding how do these people accept information? So their perspective in that learning allowed them to be a part of the team by going through the training together.
Yep, and got to see how we would operate as peers, right? So she would understand, okay, what are we doing in a peer sense? Not a clinical sense per se, but okay, as a peer supporter, I get what they're doing because I went through the training.
So she can play her role to complement that.
Exactly.
I said she because I know the person, so I probably shouldn't have.
Shout
out.
Shout out to her. You know who you are.
You know.
Yeah.
It's important too, guys, to discuss that, not stopping that training there. Once you get your teams established, include your township supervisors, include your union leadership, include your risk management from your city or county or township organization. Let them understand what this team is doing. Let them understand a little background on why we are involved the way that we are. They don't need to be trained. They don't need to be certified, but let them be a part of that training so they realize, the importance of what is happening within your organization. It's huge to have that union leadership understanding that. We went through a phase in Grand Rapids where we had our risk managers sat through our training, so they understood what the police and fire departments peer teams were doing in the training we were providing for our people and our people's families. So it's important to kind of include that. Maybe the next step as well of not just our mental health professionals, but who else can we make sure that understands this whole concept?
Absolutely. You nailed it.
Perfect. Now, what about self-care? You guys probably take on a lot of calls, right? And so you guys got to check in. What's the rule on your assessment over a period of time? Do you got to check in with that clinical coordinator as a patient? Do you got to go see your own clinician? Like, you almost need an annual assessment beyond our physical that we get from our primary care physician.
Absolutely. Self-care for the peer supporter, I can't stress enough. The thing is, you're willing to take on a lot of other people's stuff. A peer support.
You're not joining a team who's getting calls to tell everybody how great of a day they're having.
Yes. So you're going through your own life stuff, right? We all have our stresses. We all have our things that we go through that we're carrying around. And then you voluntarily go into these situations that are heavy situations a lot of the time. And that now gets put in your backpack. And, we always go out and tell people, hey, you need to go talk to somebody if this is bothering you. You need to unload your backpack. Peer supporters, I can't stress this enough. I know on our team, it's required every 6 months, minimum every 6 months, you go talk to a clinician. It's just to off-gas those things. I'll tell you, at least for me personally, I go every 2 weeks. I deal enough in peer support and take on people's stuff, hear their stories. Yeah. I need it every 2 weeks.
Right. Other life
and I have life stuff, right?
Yeah.
But it's not just going to talk to somebody, right? It's making sure after you do those traumatic call outs, you kind of all meet as a group and almost debrief afterwards too, right?
Yeah.
But the one thing that I also stress a lot when it comes to peer supporters, know when to take a step away. Know when your plate is full, because it will get full at some point. Everything outside of work or peer support, life fills that plate. Everybody on our peer support team at some point, including myself, has texted the team and said, hey, I need to take some time away. I need a little break. Just recently, when my dad was sick and then he started going on hospice, I texted the team and said, hey, listen, I can't do any of this. I need to take a break. I need to take a step away. And everybody understood it, because it's knowing when that plate is full and you need to take that step away is also part of self-care. It's prioritizing that work-life balance of something's going to break here if I don't do it, right?
And that's where a lot of people are at when they don't even know where to seek the help to begin with. So
exactly.
You don't want to get into this paradox of I'm the helper who needs the help.
Yes.
Now you're just in this vicious cycle.
Yes. One of the worst things that you can do when you become peer support is have this vision of now stuff isn't going to bother you or can't bother you because you're the peer support person, right?
Right.
And unfortunately, a lot of peer supporters are pretty high on the suicide list, because they have this kind of aura of, well, I'm the peer support person and I'm asking for help now. The same thing that we tell everybody else still applies to you. You're human. You can only take so much, right?
And your personal life is still ongoing.
Yeah.
You're
Life
adding
doesn't
more
stop.
other people's personal issues and sometimes professional issues. You still got a job. You still got a family. Sometimes it's too much. So I think backing away from anything, and what's nice about this voluntary type of team is that you're not exactly relying on it for your income. So it is something that maybe part of a team is making sure that everybody has the ability to kind of back off when they need to, but also making sure that you got enough peer supporters around on the team to actually fill the need of those call-outs.
And that's one thing like we talk about in the peer support class is adding more peers than you think you need.
Yeah.
Because there's going to be times where you've got people who are on the bench.
They're not a part-time job. They're not signing up for that.
They're on injured reserve.
Yeah.
You know, if something big comes in, they'll come off the bench, but have enough people to where you can give people breaks without breaking them.
Sure.
You know what I'm saying?
Sure.
And
Where you don't
so-
got to stress over it. Because next thing you know, you're the head of a team, you're stressing over having people available, man. It's a huge paradox.
Yes, I can speak that one from experience, 100% yes, but yeah.
Okay, well, that touches on making sure of taking care of yourself. You know, Mike Wierenga, let's just do a quick recap before we get into our final thoughts of what are the first steps for any department to establish a peer support team. Is it as easy as just calling FST5 and saying, hey, I want a peer support team?
Well, I think one of the biggest things is you kind of think, all right, where do we begin? And then where to begin is different for every organization. You know, I mean, are you looking at doing an internal team of an organization that is 6 employees? Are you a rural volunteer department that has 20 or 30 or 5 or 10 people? And you think, what do we do and how do we make a change internally here? Are you a career organization in different parts of the state that says, hey, we have different resources, finances, and staff that kind of to follow up with what you guys just said, how big of a team do we want? How many resources do we have? So I think that's the first start is like, what are the needs of the organization? And then as you go from there, is this a countywide team? Is it a countywide team that's going to have our dispatchers included in these organizational teams? And is it sheriff-based run team that will help with all the local fire departments in the organizational county? So there's a lot of moving parts there. Certainly the question can be asked and sent out, and we will guide and direct and do whatever we can to help them say, all right, where do we go from here? And then that process will start with what training do we need? I think it's important to realize it's different for every organization. It's different for every area around the state. We have different needs in different places with, you know, you look at the FST5 component and corrections dispatch has different needs than EMS and fire. They have different needs if it's volunteer, if it's career, if it's private EMS, or if it's police department. So there's a lot of moving parts with that, but we can get them started in the right direction. Quick phone call, quick email, and the team here will do whatever we can to point them in the right direction.
You know, you don't know what you don't know. And it's sometimes you just want to figure out, can we do a peer support team? Meaning like, hey, let me run by what I have available in my agency and call one of these Mike guys and say, is this something I could pull off? Even that level of questioning and looking into what it is you want to do versus what you're capable of doing, I think that's another great resource to just contact FST5 to investigate the feasibility of building something like this. And if it does, well, we got all the information for the next step as well.
You know, and we've got a lot of team members that can help guide and facilitate that. You know, we've got affiliation with our organization. You've got some different teams around the state that are doing some different trainings. You know, Michigan Crisis Response Association, we reference to the state law. You've got your ICISF, your International Critical Incident Stress Foundation. These are all these options that we have that we can provide from Frontline Strong to help guide us in the right direction that we need to do.
Yeah, and I'd help you identify which one of those fancy letters you need.
And not only that, we all network together.
Yeah.
So all the peer teams and peer support specialists that work here, we all network together.
Yeah.
If you have a question about a rural peer support team or a regional peer support team, if I don't necessarily have the answer, I'm going to call up to Kobe up in Traverse City, who runs the team up there. That's a regional team. The nice part is if the one person you talk to doesn't have the answer, we know the person who has the answer, right?
We can at least put you in touch with a team that probably has the same type of logistics that you have to best match what you're trying to do. Man, does this sound like everything else we do in the first responder services? You want to grow something, you call the people that are doing what you're doing, you get advice, you find out, you call the guy with the stuff. It's not new. None of this is new.
I know a guy.
Got a guy.
Yeah,
And FST5 is the place where we kind of like treat it as the meeting place for all that.
Yeah.
So, Mike Wierenga, what's the one message you want first responders and families to take away from this conversation today?
Well, I think one of the biggest things we got to look at is we've got resources today we've never had before. I'm kind of at the end of almost a 31-year cycle, I guess, if you will, on the police, fire, and EMS side of a phenomenal career. I'd do it again tomorrow if my knees would let me, if my hair wasn't so gray. But, we have resources today we didn't have 30 years ago. We didn't have 20 years ago. And having those resources is huge. And I think there's so many opportunities just to get in front of the first responders around the state and let them know what's available is key.
Mike Mattern.
I'm going to echo, obviously, what Mike said, but also know that if you're thinking about starting a team, do it. It's not as scary as you think it is. We will walk you through it. And the one thing I'll tell people is I never realized how rewarding of a job it is. We go out and we help people who we have no idea who they are, and we never really see an outcome. When you do this peer support stuff, it's people you know, people you care about, people you work, but you also get to see where they were. And then years later, when they come back and talk to you and you see how well their life is going, it's something very rewarding where like you know that you actually changed someone's life. Like you actually helped them do that. And it's one of the most rewarding things I've ever done in my entire life. So if you're thinking about doing it,
and nobody pays you for that.
No one pays you for it. Right?
Yeah, so I want to be very clear is that peer support teams, and this may be different for agencies, I don't know, but classically, this is a voluntary type position.
Yes. But I'll tell you, the phone call you get when somebody comes back from inpatient treatment or whatever it might be, and they're talking about how well things are going and their life is so great, you can't put a monetary value.
That's
enough.
It's a non-monetary value.
That's
payment.
enough. Like
you're getting a lot out of this.
Well, you get more out of that one phone call than you would ever get out of a paycheck, right?
Yeah. I will say that when I see you at your happiest is right after something good like that happens.
Yes, absolutely.
I've seen you do it, and it lights you up, and those are the types of humans I think you're looking for to occupy these voluntary positions.
Yes, but on top of it, the one thing I would tell people, and I'll say it every show, is please just reach out. We do have the resources. We have 24-hour resources. We have people who will talk to you 24/7. Please don't be afraid to reach out. Anytime for anything that you got going on, we're here for you. We will help you. Just please reach out. That's the thing I'll always say at the end of these shows, because there's somebody out there who's going back and forth. I'm having issues. I don't know what to do. Just please reach out to us.
Yeah, if you don't have a peer support team at your agency right now, or you just want someone, you're retired or you're a family member, 1-833-34-STRONG.
Yep.
Or FSD5.org.
Yeah. But please just reach out. The resources are there. We want to help you. We'll help you get through what you're going through.
Absolutely. You're never alone.
Yep.
Mike and Mike, thank you very much for your time today. Hopefully this provided a lot of information that people want to start a peer support team or at least investigate to see if it's right for them. Thank you guys very much.
Thanks, guys.
Have a good day.
Thank you for listening to the Minds on the Frontline podcast. We have more great content coming out soon. Please check us out on YouTube, Instagram, Facebook, X, and LinkedIn. And make sure to like and subscribe to all Minds on the Frontline podcast social media channels. Thank you, and have a great day.